So, as you can imagine, we've been spending a lot of time talking to our health officer in recent days and had some very difficult decisions to make. So what I'm going to do is actually ask our health officer, Dr. Nilesh Kalyanaraman, to come up and first brief us on the metrics, where we stand from his perspective. Then I will get up and I will go through some actions that we're going to take to push down the surge. And then Gavin Buckley will get up from as mayor of Annapolis and talk about the role of the city of Annapolis in all of this. So, Nilesh.
Thank you, County Executive Pittman, for leading and continuously working to protect those at greatest risk. I'm Nilesh Kalyanaraman, the Anne Arundel County Health Officer. We had our first case of COVID on March 11th, 8 months ago. At that time, we were scrambling to get testing, contact tracing, and hospital capacity up to speed. Once we did, we crushed the curve. Over the summer, we had to take actions to keep control of the virus. Now, during the fall season, people have moved indoors. More activities are taking place, and people are just tired of COVID. That's why we're seeing the fall surge we knew would happen. Our case rate is at 23 and climbing rapidly, setting new highs each day. We're seeing over 130 new cases a day. Our hospitalizations are steadily climbing, with over 60 people hospitalized at Anne Arundel Medical Center and Baltimore Washington Medical Center. It's been over 5 months since that many people were hospitalized for COVID. For those with severe symptoms who require hospitalization and survive, the vast majority have long-lasting pulmonary and neurological symptoms. And more people are dying. COVID is far more deadly than the flu. From 2015 to 2018, in our county, the flu killed an average of 11 people each year. In 8 months, COVID has killed 271 people. In the last month, our death rate has increased significantly. COVID continues to hit blacks harder, with 1.5 times the expected number of cases and deaths. Hispanics have 3 to 4 times the expected number of cases. Low-wage workers are at greater risk because of the need to go into work without an option to telework. The impact of COVID has been devastating, and we're entering a period that will be even worse if we don't act now. Our hospitals currently have the capacity to take everybody who needs care. However, our current trajectory will flood them with COVID patients at a time when resources will be thin in the state and country. Our contact tracing efforts, one of the finest in the nation, has been operating since day one. But at these levels of spread, contact tracing cannot slow down our trajectory, and it cannot keep up with the rapidly growing number of cases. It was not built for that. The measures we've put in place have prevented COVID from being worse, and yet it's not enough. Now we've reached a crisis point. The warning signs were flashing yellow, now they're red. Now more than ever, each of us has to do the basics of COVID prevention each day. Please do the following: wear a mask, watch your distance, wash your hands. In addition, we all have to limit our activities. Our contact tracing data shows that gatherings, both family gatherings and house parties, are fueling the spread. Restaurants are high risk as well because you're meeting with folks you don't usually see with no mask and no distance. I'm asking you to stop these high-risk activities. Additionally, we need broad measures to control the spread. When we saw our cases rising in July, we took action by closing restaurants at 10 p.m., limiting gathering size, and preventing gathering in malls. We expected to and did see our case rate go down 2 weeks after we took those actions. We're all tired of COVID. To get it under control will require sacrifice. We need individual efforts and broad changes to get this under control. There is light at the end of the tunnel as vaccine advances are being made each day. But we have to keep everyone alive and healthy so that they can get that vaccine. We crushed the curve once, we can do it again. Next, I'll turn it over to Chief Tricia Wolford of the Anne Arundel County Fire Department.
Thank you, Nylash. Again, my name is Trisha Wolford. I'm the fire chief for the Anne Arundel County Fire Department. I'm here to speak on behalf of the members of our fire department who continue to remain on the front lines. But we are tired. Everyone is getting very tired, and that's mentally and physically tired. We have worked hard, just as many of you have worked hard over the 9 months, to do our part in battling COVID-19. I am asking that everyone continue to follow the rules. Wear a mask, wash your hands, and appropriately distance yourselves. We are honored to serve in our communities, and we will continue to do so at a very high level of dedication and pride. But we are seeing extremely dangerous trends in our EMS patients. We are seeing increases in the severity of a patient's condition, possibly waiting too long to call 911 for fear of going to the hospital alone, or possibly the potential to be exposed to COVID-19 is keeping them from calling. If you are experiencing chest pain or trouble breathing or potential stroke symptoms or any other severe medical issue, I urge you to call 911 so that we can help you. There are many options to address your health, such as telehealth appointments, seeing your doctor virtually, local pharmacies, and neighborhood clinics. I encourage you to choose any of these options to address your health, but always encourage you to call 911 if you have an emergency. Everyone in the medical industry is busy and overly worked at this point. We are experiencing long wait times at the hospitals and other limitations in our medical system. Again, the paramedics, EMTs, and firefighters that are out there every day are working really hard to make sure that we can provide the best service. There are only so many doctors, clinicians, paramedics, and firefighters in our country right now, and everyone is doing their best. Again, I would ask you to continue to do our part, to continue to do your part, and we will continue to do our part. Again, we are proud to serve, and we are happy to help, but it's going to take everyone. So please do your part. I will now turn things back over to County Executive Stuart Pittman.
Thank you, Trish, and thank you to all of our fire and EMS heroes in Anne Arundel County for the work that they're doing. I want to stress a few things, some of the things that Nilesh talked about in particular. First of all, the numbers. We all watch the news, and we found out yesterday that while a week or two ago we thought it was pretty bad that our deaths each day were up around 700, and yesterday they were at 1,432 Americans died of COVID. And while we didn't think we would be getting back up to 100,000 new cases anytime soon, earlier in the summer, yesterday we had 141,733 new cases reported according to the CDC. And the governor has talked about the fact that Maryland has done better than most states. In fact, we're ranked 40th in our case rate right now, our rising case rate. But what worries me is that we rank 21st in our rate of spread, in our infection rate, at 1.19. We wanted to stay below 1 because that meant that the virus was not spreading, that the rate would not be increasing. But at 1.19, we know where we're headed, and we have to act. In Anne Arundel County, our case rate ranks 7th among the 24 counties right now, and our infection rate ranks 8th, and we're in bad shape. We're in bad shape all around the state, including the small rural counties that have some of the highest case rates right now. The other thing I think we have to recognize is that while our case rates are higher than they have ever been, the situation in our hospitals is very different than it was in the spring, when our hospitals were not doing the surgeries that they normally do, and the state had asked them to stop doing that. And so we had a lot of capacity at that point. And even then, we worked on a surge plan with the state for our hospitals, with our hospitals, to meet the surge capacity. And we were recruiting people who were retired medical professionals and medical professionals who might have been laid off or were doing other work, to recruit them to step in and help to staff the surge. And that was when the virus was mostly in the Northeast. And now the virus has gone across the country, and we don't know where we're going to be able to recruit these people from because 40 states are in worse shape than we are. So our hospitals are operating at near capacity for non-COVID work. And so surge capacity is much harder to come by right now. So we can't make our plan to deal with the virus to build our surge capacity. What we have to do is push down our numbers so that we don't need that capacity. And then finally, I want to say that we don't hear the names of the people who die of COVID as often as we should. They often die alone in hospitals, away from their families. We've had 271 in Anne Arundel County reported, another 12 that are suspected to have died of COVID. We had one every day for a month. The last week has been a little bit less than that, but we know that the death rate follows the infection rate and then the hospitalization rate. We're seeing our hospitalization rate go up already significantly in the last few days. And when we compare the deaths of other things that we can prevent, and we look at what we do to prevent those deaths, there are far fewer people dying of those causes. So we work hard to prevent deaths from traffic accidents, from gun violence, from opioid addiction, overdose. We have to work hard to prevent death from COVID. So the governor made an announcement Tuesday, and I want to commend the governor for having flattened the curve in Maryland. We did the hard work back in the spring. When actions were taken to limit the mobility of our residents statewide, it worked. It absolutely worked. We all know that. The numbers came down. I was disappointed that no actions were taken across the state that I believe will lower the spread of the virus. What was announced was a reduction of restaurant capacity from 75% of fire code to 50%, and no restaurant that I have heard from thought that they could go to 75% because we have restrictions, state restrictions on how many people can be at a table and how far the tables can be apart. So the 6-foot distancing was preventing them from going to 75% anyway. So reducing it back to 50% will not decrease the spread in restaurants. Establishing an indoor social gatherings limit of 25, to me, is not enough. My house is not all that big, and I can't imagine inviting 25 people over and hanging out in my living room in the middle of a pandemic. So we want to discourage people from having those kinds of numbers in their homes. And then saying that we're going to increase enforcement is something that it happens at the county level, and I can tell you how hard we have been working at that and how we have brought people in from all departments of government to help with the enforcement efforts and how difficult it is. The job is to educate our businesses and our community, and just saying we're going to do more enforcement in itself, I don't believe is going to push down the spread. So I've been talking to the other county executives, particularly in Central Maryland. We have been on the phone with each other every week. We were on the phone with each other yesterday on Veterans Day as well. And without state action, we need to move regionally. And so I know that Baltimore City has already taken action. I know that there's a press conference very soon in Prince George's County where they are going to be taking action that does have the potential to slow the spread of this virus. So those are our neighbors to the west and to the north. We don't want to leave them hanging. We want to join them. So, first, starting tomorrow, Friday, social gatherings in Anne Arundel County will be limited to 10 people indoors and 25 people outdoors. And we're doing this because our contact tracing in Anne Arundel County and across the state show very clearly that social gatherings are spreaders. And unlike businesses where we have somebody in charge who can implement best practices and enforce them, we don't have that in social gatherings. And unlike businesses, when we limit social gatherings, we're not putting people out at work. We are inconveniencing people. But people need to step up. So that's our first step. Second, we are starting Monday suspending our Rec and Parks youth sports. Now, it's a good time of year to do that because we're winding down most of our fall seasons and about to start our winter seasons. Basketball is probably the sport most impacted. My twin boys played basketball in a Rec and Parks league last year, and they're disappointed. But I know what it was like to be in those small gymnasiums at elementary schools with two teams battling away on the court and a line of parents crammed up against the wall. So we're going to have to forego that season this year in Anne Arundel County. And then finally, the decision that has been most difficult for me has to do with bars and restaurants. And we know that you can't wear the damn mask when you're eating. And you can't wear the damn mask when you're drinking. So we're in our restaurants and our bars without our damn masks. We have limits on them. Anne Arundel County stayed at 50%. Anne Arundel County also closes bars and restaurants at 11. Last call for drinks at 10. And that helped when we did that. Other counties have followed our lead on that, and many other states are doing that as well. The debate has really been over whether to go back to curbside pickup or whether to limit the capacity indoors in restaurants further. And what we're choosing to do is to limit the capacity indoors in restaurants from 50% to 25%. And I understand that there are going to be restaurants that make a decision that they can't operate profitably with that restriction. I hope there are not many of those. I hope that the residents of this county step up and do takeout. They get just as much money and you can tip generously. We were doing that when we had curbside pickup at restaurants or takeout only, and I think we need to get back in that habit, picking up our meals at our restaurants and bringing them home and eating them there. But we're allowing them to continue at 25% capacity for now. And I know there will be some who will ask us, why only restaurants and bars? What about other businesses? What about retail and others? I have been very reluctant to do anything that might cost people their jobs, might put people out of work, especially right now when the federal government is not providing the support that they were earlier in the pandemic. And I want to thank and recognize the whole business community for the work that they've done figuring out how to operate safely, implementing best practices. We've invested $3 million from our Economic Development Corporation in funding some of those changes to make that possible. But we will see. We may have to take additional action on some retail businesses. I know some other counties are doing that as well, and other businesses where people spend time indoors amongst each other. So finally, I want to say that we understand that the restrictions, the virus itself, the fact that people are not spending money in restaurants and they're even shopping online more. We get that. The economic impact is an impact on people. It's an impact particularly on lower income people. And that's why we're spending so much of our effort and our resources at the county level in eviction prevention and food assistance and all of the holes in the safety net that we're attempting to fill And we will go to the ends of the earth to do that. That is our top priority. And for restaurant owners, I want them to know that they can not only access our $10 million, this is our largest coronavirus investment, $5 million of our CARES money and $5 million of state money through Economic Development Corporation for direct assistance. But their employees can also get help. And we're encouraging restaurant owners to call on behalf of their employees that they know are in trouble and seek help. So we have our COVID care teams that not only can provide our $500 cash assistance, but also help with bills, help with eviction prevention, and any other needs that people have. They can call the food hotline to get connected to those services at 410-222-FOOD. And as far as additional assistance, we are talking to our members of Congress, and we'll be advocating for additional federal assistance, particularly for unemployed folks who've been put out of work, and we have some optimism on that front as well. And we'll be continuing to communicate with the residents of this county. We have a recovery group that we've been meeting with regularly to talk about the steps that we're taking, opening or closing. We're going to be broadening that and doing those virtually with the public participating. So the first of those will be next week, so that people can weigh in, both business community and others, about the actions that we take and others that we should take. So I guess finally, I just want to appeal to the residents of the county that we really are in a war with this virus, and we have done well. We have won some battles, and this is a war where everybody's enlisted, and we cannot afford to abandon our posts. We cannot afford to desert in the middle of this, as we're nearing the end of this, we believe. So stick with us, please. As Governor Hogan has said, we're all in this together. And as Dr. George Everly has said, division delays recovery. So if we work together, we can absolutely push these numbers down as we need to. So one of our most important partners in this is the city of Annapolis. Gavin Buckley, himself a restaurant owner, will get up and say a few words about the work that they're doing in Annapolis to help us crush the curve.
Good morning, I'm Mayor Gavin Buckley, Mayor of the City of Annapolis. I'm wearing a camouflage mask today to make the point that we are at war with this virus, and we can't win that war unless we believe that the enemy is deadly and unless we all fight this purge together. So I want to thank County Executive Stuart Pittman for having me here today, and Health Officer Dr. Kalyana Raman for inviting me to say a few words today. I'm proud that we are partners and that we're in good communication regularly. And I'm sorry that the pandemic numbers of our county are trending in the wrong direction. I'm especially sorry that this data is revealing itself just as we come into the holiday season, which is so critical to our Annapolis local small business community. I know that Stuart and Dr. Kay are working hard to balance the needs of public health with the dire economic consequences as a result of tightening restrictions. The steps they are taking today are significant because they are heeding the warning lights. I know that the public is weary. I'm in contact with business owners and business associations on a daily basis. I know that the economic toll this pandemic has taken on workers and businesses were tempered somewhat by the CARES Act funding and by PPP loans, both of which bridged the gap in lost revenue for business, lost wages for workers, and lost tax dollars for the city and the county. But there is still a lot of pain out there. Economic pain for our businesses and emotional pain for nearly every person in our community. None of this is easy. I urge elected partners at a federal level to find a way to advance legislation for another round of funding. We also need a national pandemic response plan because of the travel between states that will definitely impact Maryland. We must have a coordinated response if we are going to not only get to the other side of this, but we also need a national response in order to manage deployment of a vaccine when it is ready for distribution. The federal government's disastrous response in spring can't happen again. My concern today is the holiday season. We see the numbers of infections rising. There is a bit of a delay, but shortly after those numbers go up, we see the numbers of hospitalizations go up, then the numbers of deaths. There are consequences. If you are not feeling well, please stay home. By now, we all know the symptoms. Fever, cough, fatigue. Just stay at home. I don't want us to lose one more Annapolitan to this virus. Contrary to what we hear on social media, it is at least 4 or possibly more than 10 times deadlier than a seasonal flu. We all have to take personal responsibility for our actions. We are begging people to do the things that can mitigate spread. Properly wear a mask, watch your distance, wash your hands. The City of Annapolis is prepared to enforce mask wearing and break up large gatherings and shut down businesses who are not doing this. You have to care enough about your fellow humans and hold yourself personally responsible for your own pandemic protocols. Our local downtown businesses need your support, not just in shopping locally or opening your wallets, but in slowing the spread. You can continue to support businesses, get carry-out orders, tip generously, dine outdoors, in retail, do curbside pickup. There is nothing that will ruin the holiday season for your family or your friends and for our community, especially our business community, than to see the numbers of cases and deaths rise in the city, the county, and our state. Please take personal responsibility for your actions in order for businesses to stay open, in order for our community to have a holiday season. We are counting on you. Please help us get through this together. Thank you all. I think now we'll step up.
Questions now, if our speakers can line up there.
I'll start. County Executive Pittman, Scott Wyckoff at WBAL Radio.
Yep.
We've seen a lot of the big tents being put out that now have the walls on them, and is that a concern that you're just basically creating indoor space, that it's no longer an open outdoor space with no ventilation when all those large groups of people are in the big tents with the walls down?
Yeah, I'm glad you asked about that, because we get comments from residents about that too, when the walls come down. That's considered indoor space. And so they're under the same guidelines to separate their tables, numbers of people at tables, as indoor space in the building.
How does that work with the capacity numbers with the fire code?
So they are 25% fire code capacity indoors, and what we were doing before is that when they were at 50%, is letting them use that space to get towards their 100%. So we're still allowing them to do that. So if they add tents, they still do that, but they have to maintain the distancing.
County Executive, we're 2 weeks out from Thanksgiving. What do you tell people who want to gather with their families still, for the holidays?
I tell them, learn how to use Zoom. That's what we're doing. We're planning to connect with other family members through Zoom. If they can eat outdoors, let's hope for a warm day, and really take the time to connect every way we can. But when you have, a large group of people gathering together, you're going to spread the virus, particularly if they're people who are not don't normally see each other. And then of course we know that people can get tested before. And then quarantine from the time that they test, if they test negative, until they see each other to protect themselves as well.
County Executive, you alluded to the fact that fighting this pandemic is like a war. The lights were a little dim at the time you referenced that. Can you re-reference that for the county executive?
Sure. Yeah, I mean, we are at war with this virus. And we have had success in the early battles of this war. And we can see victory down the road with the vaccination success in the trials. So we hope that by this time next year, things will be pretty close to back to normal. So we have to finish the job we started, and nobody should abandon their posts and desert in this war.
I got 2 questions. First, have you considered, or is it maybe down the horizon to institute a mask mandate like the city has? And then second question, with restaurants going down to 25% capacity, with social gatherings going from 10 indoors to 25% outdoors, when it comes to
25 people outdoors,
25
yeah,
people
yeah,
outdoors.
yeah.
When it comes to retail, we saw the grocery stores and the big box stores limiting the amount of people that could come into the store. Does that come from you or the state? Could you do that? Because it seems like that would be, if we're going to do all these other things, people can, you still have hundreds of people in a Walmart.
Right,
So
right.
I'm just curious, first the mask mandate, and then can you take steps to curb that?
Yeah, that is on our list for enforcement. We're in conversations about how to enhance our enforcement efforts. And one of our concerns, especially with the holiday season's coming and a lot of shopping going on, is big box stores and grocery stores that were very careful about the numbers that they let in early on, and many of them are no longer counting. And we've started to see larger crowds in those stores. So we will be working with them to get back to those activities.
Okay. And then the mask mandate, have you thought about that at all?
Yeah, well, we implemented, in fact, before the state of Maryland, the mask mandate that says, indoors and outdoors, when social distancing cannot be maintained, that masks are required. Hasn't been enforced as well as we would like, especially in some situations. So we have that, and we're going to continue to figure out ways to enforce it.
Thanks.
A question for Mayor Buckley. You have Midnight Madness coming up the next several weeks. Is that still planned to move forward? I mean, a lot of people in downtown potentially.
I think we're reacting to this week by week, so we have to make those calls as the situation develops on the ground. So obviously we would like some of those things to be in place to help our retailers, but at this point we have to kind of see the situation as we get closer.
I have a question for the health officer also. Can you explain, one of the issues that a lot of hospitals and medical facilities had back in March was they didn't have enough PPE, they didn't have enough resources to battle this. Do you feel that they do have enough PPE now, but they're just seeing more people come into these facilities that they can't handle it? Or maybe if you could just explain how these hospitals are doing and how bad it really is?
Yeah, so in March, April, May, one of the things that happened was that elective procedures were canceled, and frankly, fewer people were moving about, and we saw the effects of that on their health. And so there was both space in the hospital, there was staffing in the hospital, there were PPE challenges, but it was being diverted to COVID purposes. Right now, the hospitals are operating at a normal capacity, which is near full. What's different now is a couple of things. One, we're not asking them to defer routine care, and we don't want to get into that position. The second is that while our PPE stocks are good now, the challenge we have is that every single state in the country is on the way up, with 40 plus states in the red zone. When emergencies are happening, the emergency management system is meant to divert resources from places that are doing well to places that are not. If everywhere is doing poorly, we're going to run into shortages. We saw that with our testing that happened this summer. We were doing well, but because of increased hotspots throughout the Southwest and Southeast, our testing numbers were delayed. That's happening throughout the entire country now. So that's our challenge, is that our hospitals are having to compete not only with others in the state, but others in the country for staffing and for PPE. And so through no fault of their own, we're all going to be in a bad spot if we don't get control of this quickly.
Thank you.
Any last questions?
Actually, for the health officer, since we're about 2 weeks out from, since Halloween, are you maybe attributing some of this to Halloween activities at all?
Unfortunately, the rapid rise that we're seeing, we're not going to be able to detect a signal from Halloween, to be quite honest. Whatever blip is there is being swallowed up by just the rapid spread through all the other means.
Thank you, everyone.
Can you talk about the app just really quickly, encouraging folks to get on?
Sure. This is the MD COVID Alert app. It's meant to enhance our contact tracing. It's a feature that you need to enable if you have an Android or an Apple iOS phone. It essentially allows the phone to detect how long you are near different people. It's a passive system, and it only gets transmitted if you say, I have COVID, I am opting into this, so that other people can know, or you say, I have this app and I want to be notified if I was a contact. But it's a way to enhance our ability to do contact tracing, because you may be in situations where you don't know the name or the person you're with. You're on the line at the grocery store, you were at that sports event, you were unfortunately at a party and you don't know everybody there. But it's a way for us to enhance contact tracing. And so we recommend that people do download that app and help us with our efforts.